Do you know there is a test that you can take to see if you have ED or not and to see if you improve after treatment? Well, stay tuned in this episode. I'll dive into it and go over all the things you need to know. This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. Do you know that you can measure the severity of your ED or that you even have ED? Well, there is a validated test that's been used for the past 2 decades that is called the International Erectile Dysfunction Test, IIEF, or the SHIM test, SHIM, which has been validated by research as well as been used by doctors throughout the world to grade the severity of ED and to also help determine treatment protocol. So I'm going to show you that because this is a quick way to find out whether you have ED or not. Interestingly, there was a large study that was done on 3,000 men, and they found out that about 67% of them don't even know that they even have ED, according to this questionnaire. What this questionnaire shows is the 5 questions, and you answer it from a scale of 1 to 5, with the most severe ED is 5 point, and then no ED is between 22 and 25 points. So let me show that to you. You answer what your symptoms are within the past 6 months. And the first question is, how do you rate your confidence that you could get and keep an erection? And then you answer from a scale 1 to 5, very low, moderate is 3, high is 4, and very high is 5. So if you are able to see my screen, you can see the numbers. So that's the first question. The second question is, when you had an erection with sexual stimulation, how often were your erection hard enough to penetrate? And 1 is almost never, 2 is a few times, 3 is sometimes, 4 is most times, and 5 is almost always. Question number 3, during sexual intercourse, how often were you able to maintain your erection after you had penetrated your partner? 1 is almost never, 2 is a few times, much less than half, 3 is sometimes, about half the time, and 4 is most of the time, more than half the time, and 5 is almost always. The fourth question is, during sexual intercourse, how difficult was it to maintain your erection to completion of intercourse? Score of 1 is extremely difficult, score 2 is very difficult, score 3 is difficult, score 4 is slightly difficult, and score 5 is not difficult. The last question, question number 5, when you attempted sexual intercourse, how often was it satisfactory for you? Score 1 is almost never, score 2 is a few times, less than half the time, score 3 is sometimes, score 4 is most times, more than half the time, and score 5 is almost always. And so you tally up your score, scale from the least is 5 up to 25, and when you tally up your score, and this is a reflection of your activity from the past 6 months, and if your score is 22 to 25, you have no ED, and if your score is 17 to 21, you have mild ED, and your score is moderate to mild, that's the score of 12 to 16, and then if you score between 8 to 11, that's moderate ED, and if you score between 5 to 7, that's severe ED. And this will help, at least for me, guide me in how I recommend treatment. So the more severe ED you have, you probably need more intensive and longer treatment versus someone that's mild or even mild moderate. Most oftentimes, if you're older and you have a decade of ED And without medication, you're probably is severe. So you score between 5 to 7, and it's going to take a lot more to treat that. But we can be treated. I've had patients that are severe, scoring at 5, that with treatment with your own stem cells, such as platelet-rich plasma and shockwave therapy and testosterone, and also combination with Botox and of course lifestyle modification, that patient can go from severe to even a mild. And when it's mild, if you keep on with good lifestyle modifications such as minimize alcohol, no smoking, sleep, stress reduction, and exercise and a Mediterranean diet, you can have improvement. We've seen it happen with patient. In the severe patient and patient that has had at least 2 decades of ED, it may take longer, as in like maybe 6 months to 9 months to see the improvement, versus if you are a mild between 17 and 21, then maybe just modifying alcohol or stopping smoking or decreasing stress, get better sleep, changing your diet, and checking your testosterone. Maybe that alone will be able to reverse your ED. And so, as with anything, if you start treating it early, it doesn't take that much to reverse it. And if moderate, even mild ED, you can actually have reversal fairly quickly, very, very quickly, within probably a month to 3 months. But you let it go for decades, it's going to take a lot longer to treat it at this time. But what the message I'm trying to get out is like, treat yourself like your car. If you're starting to have symptoms, or you're starting to feel like, especially with erection, if your erection is not as firm as it used to be, or you feel that when you penetrate it's not as firm, take this test. Take this IIEF test. See where you score. Be honest with yourself. If you have mild ED, first things first, let's get your blood measure. Let's see what your cholesterol is, your blood sugar, your testosterone level, and look at, are you sleeping? Or how's your stress level? How's your diet? Are you exercising? Are you overweight? Look at that first. And if you're mild, if you just tweak some of that, what I just mentioned, you can actually probably improve your ED without resorting to taking ED medication. And most of the cases that I see with the patients I treat, the thousands of patients I treat, is that they're probably mild and severe and moderate, but the most of them are probably moderate. They're ranging between probably 11 to like 17. Just know that your ED didn't occur overnight, okay? It takes years to have symptomatic ED, but the good news is that you can reverse it, and there are new treatment to reverse it, like my framework of the Get Hard system of addressing the 6 systems of the brain, the emotion, the hormone, and the blood vessel, the nerve, and then the penis muscle. My framework of the Get Hard system is the new way to treat ED that will restore function again without medication. We've seen it work in thousands of men. So now, if you feel that you're not performing as well as you used to, take this test, see where you're at, try, and then as you make the improvement, about 3 months later, take this test again and see where you're at. This is an objective measure of your performance, and it's very much validated. I see my patient improve from mild to no ED, and from moderate to even no ED as well. And the older you are, the more likely you may have more severe ED. Essentially, the longer you have ED, you're probably going to progress to severe cases. Now, just know that even though you have an erection with Viagra, doesn't mean that your ED is treated. But if you take this test without Viagra, that's where you should be. And what's even worse is that if you take this test with Viagra and you still have ED, that means that you probably have a pretty moderate to severe case of ED, and you're definitely going to need some intensive in-office treatment, such as platelet-rich plasma, shockwave, and now the new sexy treatment with Botox injected into the penis, which then relaxes the muscle, and it's essentially having Viagra in your penis all the time, and that the muscles relax. All you have to do is just get aroused in your brain and get stimulated and bring in more blood flow down there. Okay, so the next episode I'm going to talk about the test to test your libido, as well as your testosterone. And I want to mention before I leave is that the definition of ED is the inability for a man to have satisfactory sexual intercourse with penetration. So that means that ED can range from a man just taking longer to get an erection, or he has an erection and he loses firmness, or he has an erection and is not able to penetrate, or he penetrates and he loses his firmness, all the way to inability to have orgasm or even inability to have erection at all. So that means you can still have an erection and still have ED. So I will see you in the next episode, and we will talk about libido and testosterone. Don't forget to subscribe to my podcast and also get your free gift in the show notes. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instructions to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart related problems such as strokes and heart attacks. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.